بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسول الكريم وعلى آله وصحبه ومن تبعهم بإحسان إلى يوم الدين. Dear brothers and sisters, welcome again to our weekly program with Dr. Zubair Saeed, the COVID-19 updates. And we welcome you to this program as always. First and foremost, we praise Allah subhanahu wa ta'ala that made us witness Ramadan, and alhamdulillah, when our last day of Ramadan, and may Allah subhanahu wa ta'ala accept the siyam and the qiyam and the sadaqat and all good deeds, and may Allah subhanahu wa ta'ala give us a blessing for the Eid Mubarak. May Allah accept from us and from you. تقبل الله منا ومنكم وكل عام وأنتم بخير. To all of you and to you, Dr. Zubair, as well. And welcome again to the program. And we thank you for being with us all the time. As you know, Dr. Zubair Saeed is a community health specialist, and he's from Fairfax County Health Department. And he has been with us on a weekly basis now, giving us the most up-to-date information on COVID-19 and public health recommendations and advices for our communities. So I'll leave the microphone for Dr. Zubair. So please go ahead.
All right. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome everyone. So in Fairfax County now, up to this point in time, we have 9,044 confirmed cases of COVID-19, including 1,208 hospitalizations and 334 deaths due to COVID-19 in Fairfax County as of today. And now looking at the curve of cases during the past, I would say 2 weeks, it does look like the curve is bending, looking at the data from the past 2 weeks or so. So we still need to see it go down further to see a downward trend of cases. But it looks like we're on tap to reopen Northern Virginia on May 29th. If something changes, of course, I will let you know. But so that is somewhat encouraging news that the curve is indeed bending. Of course, that doesn't mean that we need to stop doing social distancing, washing hands, and all of that. We need to continue doing all of those things. But it's encouraging that this is finally looking like it's starting to bend in our area. Some information from the CDC this week. The Centers for Disease Control now says that 35% of COVID-19 infections are asymptomatic. The CDC also says that its best estimate is that 0.4% of people who show symptoms will die from COVID-19. And the agency also estimates that 40% of coronavirus transmission is occurring before people feel sick. For people 65 and above, the CDC puts that mortality rate at 1.3%. For people 49 and under, it's estimated 0.05% of symptomatic people will die. So under this best estimate scenario, they say that 3.4% of symptomatic people with COVID-19 will require hospitalization, and that rate rises to 7.4% for people 65 and above. Now the CDC is also very careful to put out some disclaimers about this data, this new information. They say that these estimates are intended to support public health preparedness and planning. This data, these models are not necessarily predictions of the expected effects of COVID-19, and they don't necessarily reflect the impact of any behavioral changes, social distancing, or other interventions. In the past couple of weeks, we've talked about the Kawasaki-like syndrome, now known as multi-inflammatory syndrome in children, MIS-C. The CDC has put out a warning about this, and they have some guidance for the public in general. So the CDC recommends that you contact your child's doctor, nurse, or clinic right away if your child is showing the following symptoms: fever, abdominal pain, vomiting, diarrhea, neck pain, rash, bloodshot eyes, and feeling extra tired or fatigued. Be aware that not all children are going to have all of these symptoms. You should seek emergency care right away if your child is showing any of the following emergency warning signs of multi-inflammatory syndrome for children, such as trouble breathing, pain or pressure in the chest that does not go away, new confusion, inability to wake or stay awake, blue lips or a blue face, and severe abdominal pain. So if your child is experiencing any of these symptoms that I just mentioned, you need to seek emergency care right away. In other words, call 911, go to the emergency room. How might doctors care for your child if they're in this condition? Doctors, they may do certain tests to look for inflammation or other signs of disease. These tests might include blood tests, chest x-ray, heart ultrasound, or abdominal ultrasound. Doctors, they may prescribe supportive treatment, basically medicine or fluids to make your child feel better. They may use various medicines to treat inflammation, for instance. Most children who become ill with this syndrome will need to be treated in the hospital. Some of these children may need intensive care, so the pediatric intensive care unit, they may be in there. Parents, if you have concerns about your child's health, about them developing this syndrome, remember this syndrome is associated in some children who have COVID-19. Not all children, and I would say a very small percentage of children, but it's definitely something that's serious, and parents should be aware of. And if you have concerns, of course, you can always contact your pediatrician or other healthcare provider about this. I wanted to talk about interferons today. So this coronavirus, we're learning more and more about how it causes disease, the mechanisms by which it causes people to suffer immensely or even die. And now we're learning about this virus, its ability to block interferons in the body. So what are interferons? So interferons are proteins that are released by infected cells in the body. And interferons have a purpose whereby they are kind of like a call to arms, so to speak, that will slow down the virus's ability to make millions of copies of itself. And this process usually lasts 7 to 10 days if interferons are released, and they control virus replication. And it kind of buys some time for the body to activate a second group of genes to act. So the first phase is the call to arms, as I said, and that's where the interferons are essential. The second phase is what you can call the call for reinforcements. So in the second phase, what happens is that a separate set of genes, they activate cells to secrete proteins called chemokines, which are biochemicals which raise like an alarm that notifies other cells in the body to reinforce action in the body. And it activates B cells in the body to produce antibodies. It activates T cells in the body to search and destroy virus-infected cells. And all of these cells, they race to the scene in the body. So if all goes well, in the first phase, the call to arms by the interferons, it holds the virus at bay long enough for the lethal professional killers, the call for reinforcements, to arrive to start eradicating the virus. Now, most viruses, they interfere with some aspect of this call to arms and call to reinforcements. So how does coronavirus and this novel coronavirus fit into this? So interestingly enough, a study that was released in the journal Cell, researchers, they found out that basically what happens is that the coronavirus blocks the release of interferon. So it blocks the phase of reaction called the call to arms phase. And basically because of that, there is no break on the virus's ability to replicate. It's a runaway viral replication because no interferons are released. In fact, researchers found that no interferons were identified in the lung cells of COVID-19 patients. So that means the virus has this ability to replicate and copy itself without limit, because there's no interferons. And furthermore, what happens is that this call for reinforcement, where other immune cells from the body are called to the scene, this happens to a great degree, and we've mentioned that before, and also the body releases more of these cytokines to call for those reinforcements. But in that process, cytokines, of course, also result in more inflammation in the body, and these cells which are involved in oxygen exchange in the lungs, they are also killed in this process. So that also leads to further respiratory distress. So just wanted to share the results of this study. Thought it was interesting. So the basic find here is that coronavirus seems to have this ability to block the release of interferons by cells which are infected with the virus. We know that in elderly people, and people who have, for instance, diabetes and heart disease and other chronic conditions, their immune system doesn't function as well as younger people. And in these people who are older, and if they have chronic conditions, it also reduces their ability to release interferons. So since the coronavirus is already doing this, and if somebody is older, then it's a big mess. It's a big mess. So which helps to explain why older people and people with chronic conditions die of this more commonly than other people. Now, this has led some researchers to theorize that perhaps adding interferon to drug therapy as a part of treatment for COVID-19 could be effective. And of course, they've already such studies to investigate this are already underway. And I even mentioned this last week in one of the studies that I mentioned. And they are finding that the preliminary results of such studies are finding that adding interferon as part of COVID-19 treatment is effective, is somewhat effective. But of course, they need to do more research and more studies, and we'll definitely follow that. Okay, now on to other miscellaneous studies. The American biotech company, Moderna, they had a successful phase 1 trial in their vaccine candidate. They are now shifting to phase 2 of vaccine testing. Phase 1 showed that the antibodies that were produced in response to this vaccine were formed, and these antibodies were neutralizing the virus and its ability to infect cells. So it's encouraging news. It wasn't, it's not a large study. It's only phase 1. Now they're going to shift to phase 2 and further investigate the effects in people and see if the results can be duplicated. And if it can, they're going to involve more people as well in phase 2. And then if it's successful in phase 2, they'll proceed to phase 3, which is even more extensive testing. In another study, and we mentioned this before, how smokers are more at risk for severe disease and death due to COVID-19. But a new study found that smokers are more likely to express the ACE2 protein that we've talked so much about, that allows the virus to gain entry into cells in the body. So researchers report May 15th in the journal Developmental Cell, they found and they published their results that smoking increases the expression of ACE2. Which again allows the virus to infect cells. And this could be one of the reasons why smokers are more at risk for severe illness and death due to COVID-19 compared to non-smokers. Recommended vaccinations for children who are aged 5 months has declined dramatically in the United States, from approximately 2/3 of children being vaccinated from 2016 through 2019 to now fewer than half this year, up until May of 2020. So the CDC is now worried that this dramatically reduced vaccination rate among very young children could lead to outbreaks of vaccine-preventable diseases like measles. Fortunately, the Fairfax County Health Department is actively holding free vaccination clinics for children around Fairfax County. I have dates and locations and a phone number to call. There's a lot of locations. So rather than just go through it all right now, You can email me, and also you can contact Brother Abdul Qadir. I've also emailed him as well with the information about these vaccine clinics for children and where people can get free vaccinations for their children in these vaccine clinics around Fairfax County. So you can email me or contact Brother Abdul Qadir, and we will give you that information on what phone number to call and where to go for these vaccine clinics. A case-controlled study of 75 obese COVID-19 patients found that obese patients had on average a 5-day longer hospital stay and twice the rate of severe or critical illness, which again helps to solidify obesity as a significant risk factor for COVID-19. A retrospective cohort study of 65 hospitalized patients in Brooklyn, New York, showed a higher survival rate and lower intubation rate, meaning being put on a ventilator, in patients who received calcium channel blocking medications. And these are medications that are commonly used for heart patients, but they found that calcium channel blockers are somewhat effective in helping COVID-19 patients in hospitals, at least according to this study. Again, more investigation needs to be done, but some encouraging news as well. And then finally, researchers who have now examined the lungs of patients killed by COVID-19 have found evidence that the virus attacks the lining of blood vessels in the lungs. And it's a critical difference from the lungs of people who have died because of flu, according to a report published Thursday in the New England Journal of Medicine. So critical parts of the lungs of patients who have been infected with this novel coronavirus also suffered many microscopic blood clots and appear to respond to the attack of the virus by growing tiny, tiny new blood vessels, according to this study. Now, these tiny, tiny blood vessels in the lungs these blood vessels are thinner than a hair. So these are very, very fine, tiny blood vessels in the lungs. These blood vessels in the lungs are very key because these are the blood vessels that are involved in gas exchange, oxygen exchange, carbon dioxide exchange in the lungs. And what researchers found in this study is in these very key, tiny, microscopic blood vessels, they found that they were being blocked because of clotting. You can call these like microscopic clots. And because the clots were blocking off the blood supply in these tiny blood vessels, the body reacts to this by trying to find a new way for the blood to circulate by forming other tiny blood vessels. And this is a process called angiogenesis, whereby tiny new blood vessels are formed. But it turns out that what happens is because these tiny blood vessels basically split, form a new tunnel, and researchers believe that this splitting and this new blood vessel formation contributes to turbulent blood flow and might actually be even more harmful to the patient who has COVID-19. So if you would like any information, if you want to be added to my COVID-19 email briefings, you can contact me at zubair.saeed@fairfaxcounty.gov. And as always, I conclude by reminding everyone to continue to stay at home, socially distance, 6 feet, wear a cloth face covering when you go out, wash your hands with soap and water for 20 seconds, cough and sneeze into your sleeve, avoid touching your eyes, nose, and mouth, isolate yourself if you have symptoms of COVID-19, and quarantine yourself for a period of 14 days if you've come into contact with someone who has COVID-19. Jazakallah khair, and I wish everyone a joyous and blessed Eid Mubarak.
Jazakallah khair, Dr. Zubair. Thank you so much for the presentation and all these updates. Just to reiterate on some of the numbers that you mentioned earlier, according to the CDC, as you said, about 1/3 are asymptomatic, and the death rate is average just for all cases is 0.4%. That seems to be pretty much lower than what we thought it would have, before. And that's actually in itself good news, in a way that, yeah, and
But I
also,
but
go ahead.
I want to emphasize though the CDC also says that that's their best estimate, and they also say that that could change. That information could change, but this is quote unquote their best estimate up until this point in time that they say fatality or mortality rate is 0.4% across the general population.
That's great. I'm not sure if this, I didn't review those studies. You probably did. Was this based on the total number of the cases that we have so far, or is that based on?
It's according to all the data they have.
Understood. Understood. Yeah. Okay. Very good. And now, as far as the vaccination for the children, like you mentioned, many people, they're just afraid to visit places like doctors' offices and hospitals. And I know, from the Nova, also they mentioned the ER visit for other diseases are much, much, the numbers are down. People sometimes they have a heart attack and a stroke and they just rather stay at home. But the
Yeah.
hospitals are safe. And now the hospitals are getting more experienced in terms of triaging patients. So don't worry. If you're sick, you must seek medical attention. And as far as the children and vaccination, also the Fairfax County, as you mentioned, and we will bring those information to you later on, as Dr. Zubair mentioned, that Fairfax has several clinics that give free vaccination. The bottom line is, remember, those children need to be vaccinated because if you don't, it's a very those are very preventable diseases that we should really make sure that we get this. Can you tell us a little bit more about the Kawasaki? I mean, is this? I mean, I know you mentioned it could be related to COVID. Okay, is it every Kawasaki COVID, or is it just maybe 10% or 20% of Kawasaki is COVID? How
Well,
could we say?
the thing is that first of all, they're not calling it Kawasaki disease anymore. They're calling it multi system inflammatory syndrome for children because it's not exactly like Kawasaki disease, although there are some significant similarities. Um, but and again, this is something that is rare. I would say it's very rare in children all across the world, but when it happens, it's severe enough that it can land a child in the intensive care unit, definitely at least hospitalization. So there, for that reason, we want parents to be aware of it. That's why I went over some of the symptoms to look out for. And if they have any further concerns, they should contact their pediatrician about it.
To your knowledge, Dr. Zabir, any cases already recorded in Fairfax with this MIS children?
Uh, I don't, I'm not sure about Fairfax County. I think not, but there has been a case confirmed in Virginia.
Understood. I have a question here. It says the president orders states to open religious buildings with the count. Will the county provide us any guidance, or should we follow the CDC guidance if they release any?
Okay, yeah, good question. So for now, my advice to the whole Muslim community is that we are following the local guidance, meaning from the governor and Fairfax County officials, including the health director for Fairfax County. And we are currently in a phase zero lockdown mode, at least up until May 29th. It could be extended, but let's see what happens. So until then, no house of worship should be open. As far as I know, no masjid is open for Salatul Eid. No masjid in Fairfax County is offering Salatul Eid. You can correct me if I'm wrong, but to my understanding, that's the case, and that should be the case. Now, as far as May 29th, that is Friday, and of course, Salatul Jummah, people have questions. I will be meeting with the health director on Tuesday, and based upon my conversation with her, I will be providing the Muslim community with more updated guidance. I do know that the governor released guidelines for houses of worship to operate at 50% capacity when they shift into phase one reopening. So we're scheduled to begin that phase one on Friday. So I would say in general, if we do open phase one on Friday, houses of worship, including masajid, can operate if they reduce their capacity, what they normally have, by 50%. But again, I want to stress that I will be talking more about this with the health director on Tuesday, and I will have more information for the Muslim community. Then I will be communicating with all the masajid on Tuesday.
That's great. We'll await your recommendation. And yes, all massages are locked down for now. Nobody, and there's no Eid prayers offered in massages, to my knowledge, like you said, the major massages that we know. I have a couple more questions here. It says, well, here is asking about what happens to the toe after someone gets COVID-19 toes. Did it affect the toes or the skin or something?
Yeah, that's something that's being seen in some patients, particularly in children, but again, not all. And it's usually even after they've recovered. And as we discussed before, these are just like lesions, like purple, pink, blue lesions of the skin on the toes. They typically resolve, meaning they go away by themselves in a matter of 1 to 3 weeks without the need of treatment. If it doesn't go away, you can definitely talk to your healthcare provider, and you can talk to them at any time if you see it. Of course, if you see it on your toes, and then they can give you some simple treatment, lotion and cream to make it go away. But it's not something that's considered serious. It's caused by the coronavirus because of its inflammatory effects on the body. It's temporary, it's not long lasting, and it's not serious.
Great. I have a question here. Has there been any updates on impacts on states that have opened up?
Um, there are, of course, all of the states are have opened up by this time, and it takes a couple of weeks really to fully ascertain the effects of this. So I really hesitate to say anything right now because I want to wait at least another week and a half before I can really say like, okay, these are the effects of reopening. I would say that many of the states that reopen don't meet the criteria according to the guidelines set forth by the CDC and even the Trump administration for reopening. However, they proceeded anyways. And so people need to be very cautious. Of course, in Northern Virginia, we have been very cautious, and that's why we didn't open up with the rest of the state, because we're just not where we need to be compared to the rest of the state. So I feel, have been cautious here, but other states have not. But let's see the effects. It is expected that there will be an increased number of cases. There's no doubt. And I would say in the next 2 to 3 days, we will reach 100,000 deaths. That seems to be a certainty at this point, Allahu alam, but that's what it looks like. I would definitely expect to see increased number of cases and deaths in the coming weeks. But how much so? Let's see. I want to see. I want to wait another week and a half before I fully answer this question, because you have to understand, it takes time from the time that somebody gets an infection to spread it out into the community, and for that person to get in the hospital and die. That takes time. It's not instantaneous, as we know. So that is about 2 weeks.
I see. And it's still, even if they open up, it's extremely important to practice the social distancing and the gloves and the washing hands and sanitizers and all this to minimize that impact as much as we can.
Yes, exactly.
Yeah, I have another question about the life, how long the virus lives on non-living, and basically saying recently CDC said that the virus does not live that long on a non-living object. How true is this? Does that mean we should not worry about wearing gloves and just wear masks?
Well, I've talked about gloves before in previous sessions, and I said in general, it's not advised for the general public to wear gloves when they go out. The reason for that is because, first of all, it gives you a false sense of protection. And another thing is when you take the gloves off, frequently people, when they take off their gloves, they contaminate their hands because most people don't take the gloves off the right way. Really the best way of keeping your hands protected and clean is to wash hands with soap and water, because even if you take your gloves off, you still have to wash your hands afterward. So it's really not advised. And the other thing is, frequently these gloves can get holes in them. They break apart. Even in hospitals that happens. So really the general advice is for people not to really wear gloves. They're not all that effective as you think that they might be. The best thing to do is to wash your hands with soap and water properly and frequently throughout the day. And we've talked before about how that this coronavirus remains infectious on various surfaces. For instance, cardboard. It can last for 24 hours, but on harder surfaces, it can be 2 or 3 days. Um, but it's typically not going to last more than that. Remember, there's a difference between uh, finding the presence of a virus and that virus being capable to cause infection. So in other words, just because you find virus in the air after, let's say, 3 hours, or let's say you find a virus in a droplet beyond 6 feet, or if you find traces of a virus after 1 week, in all of these situations, it doesn't necessarily mean that that virus has the ability to transmit infection. What we do know in general is that this infection is spread through close contact within 6 feet. Surfaces are not the primary way people get infected with this. That's not to say that you can't get infected that way. You absolutely can, but it's not the most common way people get infected. It's not through any surface. The most common way people get infected with this is through close contact within 6 feet, by not wearing a mask, and people are talking or coughing and sneezing into the air. This is really the primary way that this infection spreads. Of course, you can get it through other ways, but it's really not that common.
I have another question. It says, when is someone most contagious? Is it after they start showing symptoms?
Um, it's an interesting question because I've seen conflicting data on this. Some studies might say, oh, you're most infectious before you show symptoms, and then other studies say, oh, you're most infectious while you're having symptoms. But there is data from the CDC that shows that people are very infectious even before they show any signs or symptoms. And of course, now we see that about a third, 35% of cases are asymptomatic. That wouldn't happen if you weren't infectious when you don't have any signs or symptoms. This is spreading. One of the main reasons that this virus is so tricky and sneaky is that it's being spread when people don't show any signs or symptoms. They don't know they have it, and they are very infectious during that time period. It does look like that people are indeed even more infectious when they even have signs and symptoms. But it could be even be about the same. But the bottom line is you are very infectious before you show signs and symptoms.
Understood. And again, maybe because he's or the person is asymptomatic, like you said, is more dangerous because you're not aware. But that's why we have to treat everyone as a carrier of a virus, including ourselves, to protect others and protect ourselves. I have a question here. It says, how long will it be recommended to continue working from home? I guess it doesn't like staying home.
Yeah, so even with the phase one reopening schedule for May 29th, it's still going to be recommended for people to telework as much as possible. So it doesn't mean that, again, just because we get to phase one, that everything is back to normal. No, no, no. It's going to be, there going to still be a lot of restrictions in place. It's going to be a gradual phasing. That's why it's called phases, phase one, phase two, because it's a phasing of lifting of restrictions. So I do believe that in phase one, the general guidance is going to be for people to work from home if at all possible. Of course, for some people it's not possible and it's going to be okay. But in those circumstances, of course, then people need to social distance, wear a mask, wash hands, all of that stuff.
I see. I have another question. It says, if there is an eczema on the skin, is it recommended to wear gloves when going out?
Again, with the whole issue with the gloves, even with the eczema, I would definitely, first of all, consult with your healthcare provider. Number one, I'm just giving general information, so I always advise people to consult with their healthcare provider. But again, the general guidance is, even with the eczema, I'm not really in favor of wearing the gloves because of the reasons that I already talked about, namely contaminating your hands and so forth. But if there are other methods that you wanted to look into, definitely consult with your healthcare provider if you have a particular condition such as eczema. But I wouldn't say, I still not in favor of the gloves in this situation.
So, the other words on this one, do you think the virus will enter the body through the skin, expose the skin versus intact skin? Or
Uh,
is it just the airway?
No, no, it's definitely possible. In fact, there have been studies that even show that people who wear personal protective equipment, PPE, for long periods of time, they develop various dermatoses, and because of that, that allows the virus to also infect their skin because there are ACE2 receptors in the skin. So I'm not saying that that's not a possibility. That is. It's just I feel that gloves are problematic. But again, uh, I would, if you have any conditions like eczema or other conditions, really the best advice is to consult with your own healthcare provider to come up with solutions.
Very good. Well, I thank you so much, Dr. Zubair, for being with us all the times and giving us this great information. And I'm hoping the public will definitely, by listening to this, they will benefit a lot. We will continue with Dr. Zubair on a weekly basis, except the time is going to change. So, inshallah, next Saturday we'll have the same program with Dr. Zubair, COVID update, but it will be at 8:30 instead of 6:30 now. So it will be at 8:30 p.m. And Eid Mubarak, everyone. May Allah subhanahu wa ta'ala accept all good deeds and accept siyam and qiyam and sadaqat. And Jazakallah khair again, Dr. Zubair. And inshallah, we'll meet with you again. Eid Mubarak to you and all your family and the whole community. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.